let's look at the established biomarkers and factors of prognosis more closely, and let's classify them into groups. The first one would be, of course, demographic factors. And the first one under demographic factors is age. Age is very important and is associated with many aspects of the disease. And being older is a poor outcome. And then we have sex, being male. But then you also need to keep in mind the potential influence of pregnancies and menopause in a woman in the disease course and prognosis in MS. And then we have race and ethnicity as the third demographic factor. The studies have shown that African Americans, Latinx Americans, Asian Americans, and North Africans have poorer outcomes compared to Caucasians. And then we have modifiable environmental factors, which include low vitamin D level, smoking, and obesity. And these are important in the aspect that they are safe and cheap interventions, such as optimizing the vitamin D level and quitting smoking. And then we have the comorbidities that are associated with higher relapse risk and disability worsening, such as hypertension, diabetes, ischemic heart disease, and psychiatric disorders. Now let's look at the clinical, radiological, and laboratory markers of prognosis. In the clinical factors, we have higher relapse rate, especially early in the disease course, especially in the early 2 to 5 years, which is a poor prognostic factor. And then, of course, the relapse location is important, especially if the brainstem, cerebellum, and the spinal cord is involved. And then again, the recovery from relapses early in the disease course particularly is very important. Disease phase itself being in the progressive phase and starting with high EDSS at diagnosis. These are among the other clinical prognostic factors. How about the imaging factors, biomarkers of prognosis? Among the conventional markers, we have the high T2 lesion number and volume, the lesion location, particularly if it is in the spinal cord or in the infratentorial region. Having T1 black holes, and atrophy is also very important in the whole brain, gray matter, and the spinal cord. And like I said before, these are among the conventional imaging biomarkers. And in the lab biomarkers, the most important one is the oligoclonal band positivity in the CSF. It's very important in the sense that it is associated with disability worsening and also is used as a substitute for dissemination in time in the 2017 McDonald criteria.